New at 5:30 tonight, as you're spending your evenings at Little League practice and your weekends watching games, we're asking, how much is too much?
Well, nationally, children are landing in the hospital simply because their bodies aren't developed enough to meet the added demand on the playing field. Eyewitness News reporter Brian Yukono joins us now with more.
More than 2.5 million children, according to the CDC, are treated at emergency departments every year because of sports or recreation injuries. I'm asking a doctor from Hasbro Children's Hospital what he sees and what you can do to keep your kids safe. 14-year-old William Martino reviews a video of himself pitching with Dr. Peter Kriz from Hasbro Children's Hospital. The 8th grader started having pain in his arm last fall. He didn't think anything was wrong until he met with Dr. Kriz.
When I throw, sometimes I don't have my arm all the way up, and sometimes I short arm, and it causes a lot of pain on my elbow.
Here, the doctor sets up cameras to capture Martino's pitching technique from multiple angles. It's a technology, he says, that was once only available to professional athletes.
By breaking it down, looking at things in slow motion, we can analyze critical elements of each of the phases of a pitching delivery, and we have a good idea of what elements should be there, what should be normal, or what is abnormal when we look at a pitcher.
Repetition is a big factor. Playing on multiple leagues and year-round are discouraged, says both the doctor and Little League. The stress is too much on a developing body.
Velocity is king, and so everyone is really focused on how fast you can throw rather than command and some of these other things that are more important.
Dr. Kriz says Martino is the exception. Most young athletes lack strength in their legs and their core, necessary pieces of the body mechanics for any sport to prevent injury. The advice for both parents and athletes: communicate regularly. If you're in pain, talk about it and see a doctor before the problem gets worse. In the newsroom, Brian Yukono, Eyewitness News.